Hey, all my nursing students out there. It's your girl, Nurse Pia. So I'm back again with another quick 60-second NCLEX cram. Today's topic is all about diabetes. So we're going to do diabetes today in 60 seconds. I'm going to give you some quick tips, things to look for on the NCLEX when you're ready to sit. All right, so everybody get ready, get your pencils and paper out, and jot down a few notes. I have a little quick quiz question at the end, and you can drop it down into the chat. Put your answers, what you think it may be. If you're not sure, just try it. See if you like how this is going. If this is for you, there'll be more content coming out. I'm going to be doing a topic probably every day or every other day to keep you guys abreast on what's going on out here and getting you prepped for NCLEX. I want everybody to pass on your first sitting. So, with that being said, let's get started. All right, everybody. So we're talking about diabetic types. We have three types of diabetics: type 1, type 2, and gestational. Type 1, let's just go over the causes real quick. So, type 1 diabetes is an autoimmune condition, and it's where the body attacks insulin producing cells in the pancreas, while type 2 diabetes is primarily caused by insulin resistance and is often linked to lifestyle factors such as obesity and lack of exercise. So both of these are treated a little different. You may require insulin for one or both. Just depends on the patient. Every individual is different. Gestational diabetes comes along with pregnancy. It's as simple as that. Okay? So make sure you're paying attention to your type 1s, type 2s, and your gestational diabetics, following proper protocols when it comes to insulin administration. Okay, that's pretty much all we're going to touch on that for right now. We're going to move on over to the next topic. This is a quick 60-second breakdown. You guys got any questions about this? You want to run any deeper? Drop it down in the chat, and we'll talk about it. Okay, my nursing babes. So here we go. Let's regulate insulin now. So if you don't know, you got to know. We have different types of insulin: long acting, rapid, intermediate, normal, and short. Um, Long acting, you'll see such insulins like Lantus. Rapid, you'll see such insulins like Humalog. Intermediate, you'll see NPH. These are mixtures. You'll see 70/30s. Normal shorts, you'll see regular insulin. You don't want to mix glargins. Remember that. You do not want to mix the glargin insulins. And you also want to alternate sites when you're doing your injections. Don't always use the right arm. Use the left arm, use the abdomen. You could use anywhere with the fat. Don't just use one site. Alternate those sites because our diabetics, their injection sites, they become sore. So you don't want to keep puncturing the same places. Especially when you're doing your finger pricks. Pay attention. Look at the fingers. Some people don't look at the fingers. They just grab one and start poking. Look at the patient's finger. That's painful. Every time you prick that finger, it's painful. Pay attention to the sites and where you're puncturing at on the fingers. It's sore spots than others on the fingers. You don't want to puncture somebody right in the middle of their finger. That hurts. So just couple quick tidbits about insulin. Insulin plays a crucial role in regulating our blood glucose levels. It enables blood glucose to enter the cells for energy production. Together with glucagon, it helps maintain homeostasis. When blood sugar is too high, the pancreas secretes more insulin. When blood sugar level drops, the pancreas releases glucagon. And last but not least, insulin controls whether sugar is used as energy or stored as glycogen. So make sure you read up on your insulin administration, your different insulins, how they're administered, how long they take to become active, and all those good things. Okay, this is very important for all of our diabetic patients. You don't want anybody slipping into a diabetic coma on you. Okay, all right, so that's it for now for insulin. If you want any more information on insulin, you want to go a little deeper, let's talk about it. Drop it in the chat and we'll talk about it. And we can go back to this and rediscuss it again. No question is a dumb question. You got to know this stuff, guys. All right, moving on to the next. Okay, here we have hypo versus hyperglycemia. Hypoglycemia. You're going to see your patients cold, clammy, shaky. What do? We're going to give them juice, orange juice specifically. Orange juice will get them up the quickest. And you want to follow that orange juice up by what? Some carbohydrate. Give them a snack, some heavy carb. You want to boost that up. Some facilities, if your patient is below 60, it may require glucagon. So, you always want to make sure your diabetic patients have glucagon on board. If the physician has required it, make sure that it's there so that if you have to give it, it's ready and available. Okay? But if any case, they're cold, clammy, shaky, grab them some orange juice, let them drink it real quick, give them a card behind it, and let's get the sugar up. You want to recheck it, see what you get. You need more, give them something else, snack on, drink. Keep your doctor informed also what's going on. Then we have hyperglycemia. You're going to see your patient hot, dry, polyuria. What do? We need insulin. Now it's time for, yes, insulin. We want to bring the patient down. Now they're too high. So we want to get them back to their normal. Okay? So pay attention to your diabetic patients because these signs and symptoms can occur very quickly. One moment they're okay, the next they're cold and clammy, shaky, or they're hot, dry, polyuria they're experiencing. So sticky note, cold and clammy. We do what? We need some candy. We need some sugar in our life. Give us a little carbohydrates, okay? We're rooting for our diabetics to stay healthy, and we do not want them into diabetic comas, okay? Worst case scenario. So, this is our topic on hypo and hyperglycemia. Any other questions about this topic? You all just drop a comment in the chat or topic and let me know what you want to talk about, and we can always revisit this. This is just a short and quick review, just so you guys can be familiar with some of the quick signs and symptoms of hypo or hyperglycemic patient. Okay, y'all. So when we're talking diabetic emergencies, we're talking DKA versus HHS. Diabetic ketoacidosis, DKA, hyperosmolar hyperglycemia state, HHS. These are two serious complications of diabetes. And some of the key differences are DKA is associated with type 1 diabetes. It involves high ketone levels and presents with hyperglycemia, increased ketone concentration, and metabolic acidosis. HHS is associated with type 2 diabetes, has severe hyperglycemia, hyperosmolality, and dehydration, but no significant ketosis or acidosis. So the way we want to treat either of these, you're going to be using IV fluids, insulin, electrolytes. DKA presents with small breath. HHS will present with confused or dryness. They'll be dry. There'll be some confusion, maybe some altered mental status you might notice in the patient. Small breath. Usually it says smells like a juicy fruit. It smells like a juicy fruit type of breath. Okay, so if you smell any of that or you see any of that, jump onto your treatments. Most of the time this stuff is happening in the hospital. If you see any DKA signs and symptoms, excuse me, in a facility, we usually get them sent out to the hospital and get the treatment over at the hospital. And then they'll send them back. Okay? All right, we're going on to the next slide, guys. All right, so here we are with some lab values. This is just a little checklist of things that you're looking for with diabetics as far as labs go. A1Cs, anything greater than a 6.5%, we're looking at diabetes. Your fasting blood glucose levels, anything greater than a 126, we're looking at diabetes, looking at insulin. On your randoms, anything greater than a 200 with symptoms. Ketones, if you see ketones in the lab, we're looking at DKA diagnosis. So make sure you're looking at those labs and you know your lab values. All right, to all my nursing babes out here, we have reached the ending of this 60-second review. This is an NCLEX quiz, call to action. Call to action. I can't even talk. All right, so this is an NCLEX pop quiz. What's the insulin with no peak time on it? Comment your answers down below. If you know, you know. Okay? And follow for more NCLEX hacks. You'll find me on TikTok, IG, Facebook, Snapchat. I'm here for you. It's your girl, Nurse Pia. Checking in, checking out. I'll see you guys soon. Let's get those test scores up.